Good evening, everyone. I'm Dr. Varsha More from Ayurveda Network, and I extend a warm welcome to all the participants and our guest speaker for the first lecture in this webinar series. This webinar series is being hosted by the Ayurveda Network BHU. For those who are unfamiliar with the Ayurveda Network BHU is a network of experts established under the Pandit Madan Mohan Malviya National Mission on Teachers and Teaching of Ministry of Education, Government of India. This has been accomplished under the subject-based network component of NMTT program. Since February 2022, this initiative has received support from the Ministry of Ayush under the Ayurgan Central Sector Scheme for the web-based, that is online educational programs, which is being coordinated by Rashtriya Ayurveda Vidyapit, New Delhi. Ayurveda Network has already hosted approximately more than 460 lectures on our website at ayurvedanetworkbhu.com. So the purpose of launching this webinar series is to explore different facets of Ayurveda with assistance of various experts in the field. Our objective is to address a single topic each week throughout this webinar series. So today we have Professor Supriya Bhalerao ma'am as a guest speaker with us. Good evening, ma'am. It is a
Good evening.
great pleasure to have as a today's guest speaker. Ma'am is going to deliver a talk on a topic Ayurveda Siddhanta and Contemporary Research, a confluence. So before we proceed, I would like to briefly introduce Professor Supriya Bhalerao ma'am to the audience of this webinar series. So ma'am is currently working as a professor at Interactive Research School of Health Affairs, Bharati Vidyapit, deemed to be University, Pune. Professor Supriya Bhalerao madam has many diplomas and degrees to her credit, including MD in Ayurveda, also PhD in Ayurveda, MA in Sanskrit, PG diploma in clinical research, and PG diploma in bioethics from different universities. She has received special training in biostatistics, including systematic reviews, meta-analysis, and techniques in molecular biology and pharmacogenomics. Professor Bhalerao ma'am's is interested in evaluating Ayurvedic drugs formulation and procedure in context of metabolic disorders like mainly like obesity and diabetes. Her research is focused on providing insights from both the Ayurvedic and modern perspective to understand the diagnosis and management of these conditions. She has been awarded for the best paper presentation and has a list of publication in this area of Ayurveda biology, clinical research, and biostatistics. She has authored more than 25 original articles, 10 review articles, and 3 book chapters. So it is a great pleasure to have you here, ma'am, and I extend a warm welcome to you once again. So with this brief introduction, I would like to start this session, and now I request ma'am to deliver a talk.
Thank you, Dr. Varsha. Thank you, Dr. Kishore Patwardhan. And thank you, Ayurveda Network BHU, for inviting me here. And on this, especially on this auspicious day of Ganesh Chaturthi, as we all know that Lord Ganesha is a god of knowledge. And on this auspicious day, we are starting this webinar series. That is a good coincidence. And I wish all the best to Ayurveda Network for the future webinars also. Now, without wasting time, I would just like to share my PPT. Today's talk, which I'm going to I'm going to share with you few of my thoughts about Ayurvedic Siddhantas and contemporary research. And what exactly I want to do in this series, in this lecture, you will come to know in short time. So I hope the slides are visible.
Yes, ma'am.
Yeah. Okay. So this is the topic of talk for today: Ayurveda Siddhanta and Contemporary Research, a confluence. So as we know that confluence is something where two things merge or two things come together. I won't say merge, but come together and have some cross section. So we are going to see like how Ayurvedic Siddhantas and contemporary research meet at various points, and the examples of such things I am going to provide you from Samhitas. So, to start with, a very basic thing, those who are Ayurveda scholars, they know this definition of Siddhanta which comes in Ayurvedic texts. that is Siddhanto Namasya Yah Parikshakaihi Bahuvidam Pariksha. That means many examiners or many investigators have examined, assessed, evaluated a particular thing. So there is a component of reproducibility here. Then hetubhishta sadhayitva, that means there has to be some strong logic, strong reason. So reasoning or analysis is also a part of Ayurvedic Siddhanta. And after this, whichever is thapyate, that means established, that nirnay or decision is called as Siddhanta. We also know the four types of Siddhanta, which are Sarvatantra Siddhanta, Pratitantra Siddhanta, Adhikaran Siddhanta, and Abhyupagam Siddhanta. So in these four types of Siddhanta, the most interesting is Abhyupagama, which is actually considered as a Siddhanta which is temporarily posed, or it is still unproved, untested, or uninstructed. We can refer it as hypothesis. And then we know that there is a whole theory like how we can prove hypothesis as per Ayurvedic methods. So three important chapters in this context which talk about ancient research methods. All the research methods which are described in Ayurveda are Tisre Shaniya, which is in Charak Sutra Sthan 11 chapter, Rog Bishik Jitiya Viman, that is Charak Viman Sthan 8 chapter, and Uttar Basti Siddhi, Charak Siddhi Sthan 12 chapter. And you will see that there are different things which are described in these adhyayas which I have just referred to you. The first is which I referred was Tisra Shaniya Adhyay, and you can see like how the three Eshana and the Paralokeshana specifically has been established with the help of different pramanas in this chapter. And the four basic tools which Ayurveda describe for examining any hypothesis or proving any hypothesis are Aptopadesh, that is whatever has been described or mentioned by our ancient acharyas or in texts, Ayurvedic texts, classical texts, Pratyaksha Praman, Anuman Praman, and Yukti Praman. And some of you might have referred my article, which is about Bloom's taxonomy and how it reiterates Ayurvedic Pramana, because Bloom's taxonomy is something which is used very commonly in medical education technology, and it describes like what are the different kind of steps in the knowledge gaining process, so or understanding a particular phenomenon. So it starts with knowledge, then comprehension, application, analysis, synthesis, and evaluation. And when I look at the things which are there in the Ayurvedic pramanas, I think like knowledge we can get from Aptopadesha, comprehension is from Pratyaksha, application, analysis is like Tarka, and that is what Anuman Praman is. And lastly, synthesis and evaluation. So something complex from where you can predict something or you can derive something, that is what is the highest hierarchy of a knowledge process, and that is what is Yukti Pramana as per Ayurveda. Because in Yukti Pramana the situation is not previously dealt with, but the investigator or the examiner predicts something based on the different kind of situation which is available to him. So this kind of analogy we can see between the Praman and Bloom's taxonomy also. And on this particular aspect only, the paper which we have published is Bloom's taxonomy reiterates Ayurvedic Pramanas. Going further, this is what I have mentioned, Pratyaksha, Anuman, and Yukti. Going further, we know that there are Vadamarga Pada, and the important Vadamarga Pada in today's context, in the context of research, are Pratijna, Sthapana, Hetu, Drishtanta, Upanay, and Nigamana. And we know this whole process, like Pratijna is putting forth your hypothesis or putting forth your objectives, then establishing them with some logic, some examples, some data, some evidence, that is Drishtanta, and then lastly Upanay and Nigaman, that is discussion and conclusion. So, in short, how a research paper is written from in a context of, like Imran structure, that is what is described here under the Vadamarga Pada. Again, the pramanas have been reiterated in the Vadamarga Pada. Then there is a Panchavaya Vakya, as we have seen in the earlier slide also, Pratigna, Hetu, Drishtanta, Upanay, and Nigamana. This is called as Panchavaya Vakya. And as I mentioned that it is similar to what we use in today's day, the IMRAD structure, that is introduction, material, methods, results, discussion. And of course, here there is a conclusion also. So this is also a way how in ancient period any hypothesis was proved or established. Then comes the Dashavidha Pariksha Bhav, which are described in Charak Viman Sthan 8th chapter, Rog Vishek Jitiya Viman Adhyay. And this is all is taught in the Ayurvedic research syllabus also, which we learn in the final year BMS or first year of MD. That how these Karan, Karana, Karya Yoni, Karya Phala, Anubandha, Desh, Kal, etc. can be correlated with cause or reason, the instruments which we use, source of an action, action, outcomes, etc. So I need not to tell all these things to the Ayurveda scholars because they already learn these things in their as a part of their syllabus. Tantra Yukti is also one important aspect of Ayurvedic hypothesis proving or understanding the text, I would rather say. And these are the 32 Tantra Yukti which have been described in Charak Siddhisthan, and they have been used at various places, that how we can interpret, how we can understand the textual information, and on the basis of that, whether we can prove anything. So Tantra Yuktis are also used in the process of proving hypothesis. All this information, as I said, is known to any Ayurveda scholar, and this is like much read and much known information. But what interestingly we are going to deal today is principles of modern research methodology which can be seen in Ayurveda. So you will be surprised like what I am talking, but I would show you in the few slides, in next few slides, like how the modern research methodology can also be found in Ayurvedic text. To start with, I would just start with this famous and this quote which I like very much, where research has been defined, and it is very interesting quote that research has been called a good business, a necessity, a gamble, a game, but actually it is none of these. It is a state of mind. So once you achieve this state of mind, research doesn't become difficult. I always say that we always uh, restrict research in some terminologies, and then we find it is very difficult thing. But once we understand that research is nothing but a state of mind, it becomes easy. And if we see that how research starts with, then the characteristics which come like curiosity, questioning, inquiries, ideas should come in your mind. There should be motivation, there should be passion. All these things you will appreciate and agree with me that these are nothing but the states of mind. And once we achieve this state of mind, nothing is difficult for us. This is the whole research process. As we know that there is a question, we start with a question, then we have some assumption or hypothesis, we test the hypothesis with experiments, we do some observations, we document those observations, collect data, then we organize and analyze data, interpret data, and through this new knowledge is generated, and this new knowledge again give rise to new questions, and again this whole process of research continues. So these questions is a central part or heart of any research process. And if we see in Ayurveda, there are many adhyayas which starts with questioning. For example, Katidha Purushi Adhyay. There are so many questions which have been asked, and all these questions are actually very difficult to answer. They are, we can say, like evolution of Srishti, and the factors are like metaphysics, the soul, the whole process, like how the body is like this whole Pancha Mahabhut Sharir is generated, and all these things are dealt with in this Katidha Purushi Adhyay, and related to these, the questions have been asked. The next adhyay is Vatakala Kalya. So I am showing you different examples that there is something, there is one adhyay which starts with question, which is basically dealing with the metaphysics or the things which are not visible or apratyaksha. Then there is another adhyay which is on the verge of apratyaksha and pratyaksha, Vatakalakaliyam adhyay. That also starts with questions like Kim Guno Vayu, Kim Asya Prakopanam. So we know that Vayu is Amurta, but its effects can be seen. So it is on the verge of Murta and Amurta, visible and invisible. From there, the next question, the next adhyay is Snehadhyay. This also starts with many questions like Kim Yonayaha, Kati Sneha, Kecha Sneha Gunaha, and how the Sneha has to be taken, what is the sign of good snehan, snigdha, snigdha lakshana. Uh, then other factors which when snehan is administered, what has to be taken into consideration, all these questions have been asked. And adhyay starts with snehan, which is this adhyay has a practical implication directly. And one more adhyay which is very interesting, that is Vasti Sutri adhyay. And this adhyay, if I just translate these questions which have been asked here, that what are the factors observing which the enema can be administered, what material shall be used to prepare a nozzle, what should be its length and shape, what is its quality, and what are the sources of enema bag. You will appreciate that whenever we write a research protocol, suppose today I have to write a research protocol on Basti procedure, I have to ask myself all these questions, and I have to answer all these questions in my methodology part also. So this questioning was inherited and inherent part of Ayurvedic philosophy, and many, at least four adhyas, which examples I have shown, they start with questioning. So questioning is must, and questions has have to be answered. This is a basic theory of Ayurveda. So research was also a part of Ayurvedic philosophy, that we can say. The next thing which I want to discuss with you is the methodologies, the modern research methodology. So we know that there is a qualitative research, there is a quantitative research, and in qualitative research there are different methodologies which are used. And focus group discussion is one of the important methodology which is used in qualitative research. And we can see that there are various focus group discussions which are discussed or which are mentioned, described in Charak Samhita. For example, this one, that how many rasas are there, one, two, three, four, and then everybody, the acharyas who have come for these focus group discussions, they have expressed their views with some logic, that why they think that there should be four rasas or five rasas. So this is a example of a focus group discussion which has happened. Then there is another example like whether the garbha is matruja, pitruja, atmaja, satmaja, and again there is a focus group discussion that has happened about this particular aspect, like how the garbha is formed and what exactly makes the garbha. Another example of focus group discussion is which organ gets manifested or gets expressed in a embryo or in a fetus first. And again here the acharyas who have come for the conference, they have not only explained, like expressed their views that why they feel that this particular organ gets expressed in the fetus or embryo first, but again they have given some logic also, that why do they think so. So these all are examples of focus group discussions. Going further, these are the type of research studies which we generally learn in modern research methodology, that there are descriptive studies, there are analytical studies. An example of descriptive studies, cross sectional study. In analytical study there are observational studies and interventional studies, and under observational study there is a cohort and case control study. And you will be surprised to know that we can see or we can find the examples of all these kind of studies in Ayurveda texts. So let us start with the cross-sectional study. We know that cross-sectional studies are generally done to understand incidence or prevalence of a particular disease condition in a given area. If we read this Charak Mimamsan first chapter, it has been told that three substance or three entities should not be consumed in a excess quantity or more frequently. These are Kshara, Pippali, and Lavan. And if we read this description, it has been written that if somebody consumes excess quantity of Kshara, then Aukshana, Tekshana, Laghav, and whatever doshas can be manifested in the body, they have been described. And next to that, it has been mentioned that yehi enam grama nagara nigama janapadaha satatam upayunjate. That means whichever gram, cities, villages, localities use this kshar in excess quantity, they andhya, shandhya, khalitya, palitya, bhajo, means they suffer from these kind of diseases, blindness, infertility, etc. And importantly, tad yatha pratyahas chinashcha. They have described two deshas also where this kind of thing can be seen. So these are the individuals, these regions are the actually the regions where the incidence of Kshara excess can be seen. In case of Lavan also, similarly, it has been described that yehi etad grama, nagara, nigama, janapadaha satatam upayujyate. That means the localities which consume Lavana in excess quantity, they also suffer from Shithila Mausa Shonita. They are apariklesha saha. They cannot tolerate lot of exertions. But again, the deshas have been mentioned where this kind of thing can be seen. So we can say that prevalence of excess Shara consumption is in Prachya and China Desh, whereas consumption of Lavana in excess quantity can be seen in the deshas like Balika, Saurashtrika, Sindhav or Savirika. So this is how we can see like cross-sectional study where incidence or prevalence of particular thing has been studied in Ayurveda. Going further, case control study design. So this shloka, all of us have read. So what has been said here that what is the importance means what is the topic of discussion here that what is importance of chikitsa, because it is seen that there are some patients who are upakaranavanta, that means they have access to the facilities, they are paricharaka sampanna, they are atmavanta, they take their own care also. Kushalescha vishabhihi anushtitaha, they are being treated by the kushal chikitsak also. Still, you can see that some of them samuttishtamana and some of them mriyaman. That means, in spite of having all these things, some of the patients they survive and some patients die. In the same way, those who are opposite to these, that means they are anupakarana, they do not have the access to facilities, they do not have the nursing care, they are not taking self care, they are not being treated by the expert physicians, but still of them few survive. So how is it possible? And this is the question which was asked. Now, if this phenomenon we draw in this kind of 2 by 2 contingency table, which is very commonly used in case control studies, we know that we can plot this kind of table, and whatever has been mentioned in samhitas, we can just translate it in this kind of, just enter, not translate, also enter in this table, and you can see that this is how the table will look now. And obviously those who have upakaranvanta paricharak sampanna atmavanta kushaleshcha vishagbihi anushtitaha, in those samuttishtaman, that means survival percentage should be more as compared to the other group where they are anupakarana, aparicharaka, anatmavantah. So if this is the situation, then you will definitely remember this kind of table which we use in the case control study design, where cause present, cause absent. So here the cause present is the facility, etc., nursing care, etc., everything is available, not available. Effect present, effect absent, and then from this we can calculate odds ratio. So we can say like odds of survival is more if the patients are upakaranvanta, paricharaka sampanna, atmavanta, etc., etc. So this is nothing but the clear description of case control study design in Ayurveda. Going further, the next study design is cohort. And we know that this shlok, which talks about the effects of Viruddha. So, Shandhya, Andhya, Visarpa, so many conditions have been described to Viruddha. If somebody consumes Viruddha continuously for long time, he may suffer from either of these diseases. This is the interpretation of this shloka. Now, if we go to the cohort study design, we know that how the analysis is done. We calculate relative risk because the patient is exposed to some factor. In our example, the patients or the individuals are exposed to Viruddhana, and then they have the risk of developing any of these diseases. So we can calculate relative risk, we can calculate attributable risk, and importantly, what why I am saying that this is an example of cohort study, because if we study the details of case control studies and cohort study which are given in modern research methodology, the one which I have highlighted or indicated with arrow, I want all of you to read this particular thing, that in cohort studies or the in cohort study or the cohort study can give information about more than one disease outcome. So their exposure is only one, but that one exposure can give information about more than one disease outcome, because there is likelihood that one exposure or one cause, one risk factor can lead to many diseases, and exactly that is what has been described in in this shloka. That the exposure is only one, that is viruddhana, but it can lead to many diseases, and that's why I have this assumption, this is like my thinking or my interpretation, that this is an example of cohort studies, because when they have followed the individuals who are consuming viruddha anna for a long time prospectively in future, they might have come to know that what all diseases these individuals suffer from, and from this we can even calculate, as I said, the relative risk, attributable risk, etc. also. So this is example of cohort study. Going further, the next type of study design is intervention study. And I'm showing you first the example, which I feel like this is an example, or this is a uh, indicator of interventional study. So here the best in the group have been described, like Annam Vrittikaranam Shreshtam, Udakam Ashvasakaranam Shreshtam, Shiram Jivaniyanam, Mausam Bruhaniyanam. So acharyas have come to some conclusion that in Jivaniya substances, or amongst the Jivaniya substances, whichever which is best, then the conclusion is given to us, that is Shira. So before we go further, I just want to share with you this modern research methodology example, that you all must be knowing that the randomized controlled clinical study, or the clinical studies, began in 1747, when James Lead studied the effect of six therapies: oranges, lemons, and there were few other therapies on the sailors' health, uh, basically on the scurvy. So he has studied that which are the best among these, and then he concluded by doing a controlled clinical study, that is in 1747. I want to highlight this year also, 1747, and he is known as the father of clinical trials. And then he came to a conclusion that oranges and lemons are best. In the sense, if he would have written it in Sanskrit, he would have said that Naranga Nimbuko Skarviharanam Shrestho. So, likewise, we have been given here the conclusions of different studies which have been done. Kshiram Jivaniyanam, Mamsam Pruhaniyanam. So, there must be a clinical study or clinical, some experiment. I won't say study in a sense of study, but there must be some clinical experiments, and based on that, or some anecdotal evidences which were compared, and then acharyas must have come to a conclusion that which one is the best amongst the group. So that's why this becomes an example of interventional studies. Now the question will come that why then the methodology has not been described, and why you are saying that this is an interventional study. If it would have been an interventional study, then a methodology, at least some glimpses of methodology, should have been seen in the text. I would like to draw your attention to these shlokas, that acharyas have said it at various places, that pramanam hi vistarasya na vidyate. There is no limit for expansion of any particular topic, and that's why they have given in gist or in short the conclusions of their various experiments, we can say, or whatever clinical observations they have done. So we have been just told the conclusions of their experiments, and we can use them as they have mentioned it, because we in today's scenario, in today's day, we all are alpa buddhi, so we can just use those conclusions as they have mentioned. They didn't feel that there was any need to mention the methodology to us, but they have said like budhanam buddhi vriddhaye. So if somebody wants to interpret this, if somebody wants to go further into the details of these conclusions, then maybe he will find out some methodology in Ayurvedic texts also. But this is like an example of interventional studies in Ayurvedic text. That is what I feel. Then we know that now there are new study designs which are coming up, like flexible dose design, whole system studies, black box design. So basically individualized studies. So we know that we have been clearly told that purusham viksha, so not every patient will need a same dose, and that's why there is a flexibility. There has to be a flexibility in dose, and that is what is implemented in flexible dose design. So these newer study designs Ayurveda was very well aware of, or rather Ayurveda was believing in all these study designs. These are not new for Ayurveda, rather in one simple shloka, Purusham Purusham Viksha, these all study designs have been narrated in a very crisp way, or in a very precise way. We also have a generic case record form. Uh, those, I mean, when I finished my BAMS almost 28 years back, we used to have a long case to take in the final year BMS, and also a short case. So in long case, we have to take all these history, Prakruti, Vikruti, Sar, Samhanan, Praman, etc., the Dashavidha Pariksha. So this is nothing but a generic case record form, and that's why we were saying like long case, short case. So in long case history, we have to take this whole thing, and we can use this as a generic case record form for all diseases. So the concept of case record form was also there. Coming to biostatistics, again you will be surprised that okay, there is a mention of statistics or ganita. That is what is mentioned, that sankhya syat ganitam. So when there are numbers, it is ganita or mathematics or statistics. But is there something beyond this? Yes, there is something beyond this also in Ayurvedic texts. uh, Before that, I would like to take again to the biostatistics, as we have seen the research types, the study types. I would just like to take you back to the basics of biostatistics, that there are two types of statistics: descriptive and inferential. And in descriptive statistics, we just collect data, organize it, summarize, and present it. In inferential statistics, we make some inferences, we test the hypothesis, make predictions. And before this, there is one important concept which all of us have to learn, that is types of data. And we know that there are qualitative data, which are again of two types: nominal, ordinal. And then there are quantitative data, which are continuous and discrete. So this is a very basic. Before we learn even the descriptive and inferential statistics, we learn the types of data. Now in Ayurvedic text, can we see these types of data? Yes. So nominal data. uh, what are the types of diseases? Dve roganike bhavata, or what are the sources of diseases? So dve roganike bhavata prabhav vedena sadhyam asadhyam. So these are categories. These are just the nominal data example. Bala bhedena mridu daruna, adhishtan bhedena mano adhishtan sharira adhishtan, nimitta bhedena swadhatu vaishamya nimittan agantu nimittam. So all these are examples of nominal data, because these are just the categories. What is the similarity in these all categories? Because they are rog. So ekatvam tavat ekam roganikam. They all are roganika. That is the ekatvam. But bahutvam api sankheyam sat asankheyam va. These are just examples. There can be still more types of disease. There can be some more types also. So that's why there can be asankheyatva also, and that is how this is bahutva. So ekatva and bahutva, nominal data is this is the example of nominal data. Ordinal data, yes, there are many examples like Trividha Balabheda, Pravara Madhya Avara. So we know whenever there is a order, the data is called as ordinal data. So here there is a order, that is Pravara, Madhya, and Avara. So this is an example of ordinal data. This is example of one more example of ordinal data, where Vamana Veg have been described, like Jaghana Madhya Pravara. So how the Jaghana Madhya and Pravara Vega will be considered in Vamana. And if I present this same shloka, if I present whatever has been mentioned here, that what will be the quantity, what will be the end point, this same shloka, if I present it in this way, like what is a Jagana, here Jaganya, Madhya, and Pravara type of woman. And if I put the same information which is given in the shlok, you will get this kind of table. and then you can call it as a descriptive statistics because here data is collected, it is organized, it is presented nicely. So this becomes an example of descriptive statistics. So still more examples like praman, we have seen. Now this is like in praman also utseda vistara ayama, so height, breadth, and how we can measure it with swa anguli, and then different measurements have been given. So this is also an example of descriptive statistics. Here the quantitative data is used because whatever quantification tools were available in those days, with that the quantification has been done and mentioned. So this is also an example of descriptive statistics. Uh, this is very interesting, which says that what is a Anjali Praman. And while describing the Anjali Praman, they have given some Pramana like Ashta Shonitasya, Sapta Purishasya, Shat Shleshmanaha, whatever, the Udak Dashanjali Pramana, Navanjali Praman of Rasa. So this has been given. But what has been written that this is Parama Pramanam Abhidneyam. Now, this para is not maximum. We should not consider this as a param means maximum praman. This we should understand as this pramanam which has been described like udaka is dashanjali or rasa is navanjali. This praman is closer to population means maximum people will have this kind of anjali praman. So this is not maximum. This is closer to population mean or maximum people will fall in this pramana. So this is how we have to consider. It is not like that that Navanjali is a maximum because the next point which acharyas have mentioned is Tacha Vriddhi Rasa Yogi. So this pramana which has been described can be increased, can be seen little increased or decreased also. So it can be slightly increased, slightly decreased, and this is Tarkyameva. The Tarkyameva means this can be predictable. You can predict that everybody will not have the same exact amount of this pramana. You can predict that. You can even predict what can be the vriddhi and how much can be the vriddhi and rasa. That is also another meaning. So this whole thing tells us something about normal distribution. And again, everybody of you must have seen this kind of graph. This is called as normal distribution graph. And as we go away from the mean, we know that the we go away from the mean, then the percentage of individuals who fall under these go on decreasing. The highest point is at its mean. It indicates the mean. So whatever pramana has been described here, that Nava Anjali or of Rasa. So people having Nava Anjali praman will be maximum. They are at the highest peak of the normal distribution curve, and on the both sides, Vriddhi Rasa Yogi, as it will go on increasing, like 8 Anjali Rasa will be very few people, 10 Anjali Rasa will be very few people. Maximum people will have Nava Anjali of Rasa. This is the meaning, and this is what I wanted to talk to you about this particular shloka, that what does it mean by vriddhi rasa yogi. uh, Going further, inferential statistics. So there is one line which is given here, that is bhetta hi bhedyam anyatha bhinatti. So this talks about the whole inferential statistics. Whatever you want to analyze, you can analyze with different ways. It depends upon your perspective and it depends upon your expertise, your approach. So an analyzer, that is bhetta, bhedyam is whatever has to be analyzed. Anyatha is different or various ways, and bhinatti is can analyze. So the meaning of this shloka is an analyzer, that is a statistician, can analyze data in different or various ways. Uh, Now, how we can elaborate this shloka? Suppose I do a clinical study in obesity, so I can just check like what is a pre and post treatment average weight. This can be one way of analyzing data. Another way can be like pre and post treatment change of weight category. That means so many individuals were obese before treatment. They of these so many became overweight. Of overweight individuals, so many became normal weight. So this is also one way of looking at the data and analysis of the data. Then we can do subgroup analysis also of these obese individuals. We can analyze the data sex wise, we can analyze the data age wise, we can analyze its prakriti wise, BMI wise. Anybody, I mean, somebody else can think like I can analyze with respect to insulin resistance. You can have different kind of factors, multiple factor based on which you can analyze the data, and that provision or that liberty has been given under this particular shloka, that bhekta hi bhedyam anyatha bhinati. So this is a very nice sutra for inferential statistics and how we can go ahead analyzing and interpreting the data. So again, on the same line, when we do inferential statistics, generally we use p-values or probabilities. We find out like how much the effects of two treatments are similar. If the effects of two treatments are similar, generally p-value comes more than 0.05. And how much the effects of two treatment are different. So if they are different, then p will come as less than 0.05. So if this shloka samanyam ekatvakaram visheshastu पृथक्त्वकृत पृथक्त्वम स्यात् असंयोगो वैलक्षण्यम, that means they will be different than each other, anekata. So now if I put this whole shlok in this particular way, like if I have two treatments, I compare them, and if they overlap with each other, means there is some component of samanya in those treatments, the effect are similar, the effect are not very different of these two treatments, then when you apply statistics, the p value will come more than 0.05. If these two treatments are completely different, they are not matching with each other, one is better, one is not that better, one is inferior, then you will get two different, there will be no overlap, you will get two different normal distribution curve, and then your p value will come less than 0.05. So whenever we infer something, we try to find out samanyatva and visheshatva. So samanyatva will be there if the p value is greater than 0.05, and visheshatva will be there if the p value is less than 0.05. The same thing is applied even in literature search. You must have used these Boolean search operators and, or, and not. So when you use the Boolean operator and, you try to find out the cross section of the two or the samanya. When you use the Boolean operator not, you try to find out the studies which are vishesh to a particular disease, and that is how you can represent the Boolean search operators also in terms of Samanya and Vishesha Siddhanta. So I would just say like whatever whenever I read Ayurvedic text, I remember these modern research methodologies which are there in principle. They are not elaborate in an elaborate form, but they have been mentioned in a precise form. The principles are same. Only thing is they have not been given in details as the research modern research methodology has mentioned. Lastly, the research in clinical setting. We talk a lot about that clinicians should also do research, and there has to be some research component in clinics, because the research in traditional medicines like Ayurveda starts with the evidence generation from practice. So in that case, every clinician should also do research, or he is doing research in some or other way, because Charakacharya has clearly mentioned that everything, though it is mentioned in Ayurvedic text, unless we do some uya with Swayam Dhiya, then whatever siddhi we get is a random siddhi. It is a yadrucha siddhi. And no physician wants to have this yadrucha siddhi. So every physician use some analytical skills, thinking, and then predictions also, and then come to some chikitsa derivation. And that's why the research is there even in clinical settings. And this is the same thing which has been mentioned in a different way, like every case is a new clinical trial, and the physicians can observe, document, analyze, and come up with some correlations, hypotheses which can be used for further research. So this whole thing was about the principles of modern research methodology, which can be seen in Ayurvedic text. And then lastly, there are two more aspects, but they are very. I have dealt with them in a very in only 2 to 3 slides. So the thing which I would like to discuss on this platform is how we can use Ayurvedic concepts for contemporary research. Yesterday, I was just going through a brochure or a advertisement announcement of a global Ayurveda festival, Ayurveda Biology Conclave, and they have used two very nice words, nice terms. One is modern biology for Ayurveda. So, how modern biology can be used to explain or justify few of the Ayurvedic concepts, like we have seen in case of Ayurgenomics, how the genomics has been used to understand the Prakriti concept in a better way. But another thing which they have mentioned in their flyer, that is Ayurveda for modern biology. So, what Ayurveda can give to modern biology? Generally, it so happens that whenever any new research is published or somebody gets Nobel Prize, we always say that, oh, it is already mentioned in Ayurveda. This is nothing new to us. But the question is there that then why we don't say it upfrontly? Why we don't tell? Why we don't experiment on those lines and come with some new thing for modern biology? And I just want to show you one example. This is like just an example, you can say, and this is very interesting. Like in a dhatu portion, where the dhatu portion is given, it has been mentioned that from rasa rakta dhatu is made, or from rakta mouse. So a few questions have been asked, and these questions can be answered, and they can they can lead to some new findings in modern biology also. So what are these questions? That rasasya na rago asti katham yati raktatam. If rasa is not red in color, then how rakta is formed? Dravat raktat sthiram mausam katham tajjayate nrunam. So from drava rakta, how the sthira mouse is developed. From drava dhatuho sthirat mausat medasah sambhavah katham. श्लक्षणाभ्याम मांस मेधाभ्याम खरत्वम कथम अस्तिषु. So mouse med dhatu is lakshana, mouse dhatu is lakshana. Then how asti dhatu are khara, which is a next dhatu. This is very interesting. This is a complete opposite spectrum. That first the earlier dhatu is lakshana and the next dhatu is khara. So how this transformation happens? What is a machinery in between? Then khareshu astishu. Now again majja asti is khara, but majja is again snigdha and mridu. So how this transformation occurs, how this transformation happens. So if we can throw some light, if we can do some experiments on these lines, I'm not saying that I have done experiments, but these are the things where Ayurveda can give some new things to modern biology. Going further, these are the seven dhatus, and as it was told in my introduction, I exclusively work in the area of obesity and diabetes. And when I was reading this sutra, that medasvina meda iva upachiyate na tatha itare dhatavaha. That means in medasvina individuals, that is obese individuals, only med keeps on increasing and not other dhatu. So I just plot these all dhatus. Uh, in sequence, and then I could see some similarities in these dhatus, and that's why I have used a similar color for some dhatus. So you can see that Mausa and Asti, they are just next to Meda dhatu, and they are important for giving a structure or building a body. And in obesity, since they are just close to Meda, when Meda goes on increasing, these are the first two dhatus which get affected, and then we can see sarcopenia and osteoporosis. When we go next to these two dhatus, that is, we can say like two SDs, when we cross two standard deviations, so we get Rakta and Majja dhatu. And now there are upcoming reports that in obesity, mild cognition impairment is also seen. On other side, there is Rakta dhatu, and now the new concept of overnutrition induced anemia is also coming. So till now in our country we were suffering from undernutrition related anemia. There is a possibility that soon we will have overnutrition related anemia. And interestingly, you can appreciate that Rakta and Majja dhatu, they are also connected to each other in some or other way, like या एव पित्तधरा कला सा एव मज्जाधरा kala pitta rakta ashray ashray bhav. So these two dhatus are also related with each other. And then we go Still further, Rasa and Shukra Dhatu, you will appreciate again that they also have some characteristics same, Snigdhatva or Mrudu kind of characteristics. These are because of Rasa and Shukra. Now, because of Shukra Akshaya, since Meda Eva Upachiyate, Shukra Dhatu Kshaya is also seen. So, infertility cases have been described in obesity, but we do not have, or at least I have not heard, there must be something, but Rasadhatu Kshaya Lakshana should also be seen in case of obesity. And we can also appreciate that this is a kind of explanation of pratilomakshaya, anulomakshaya, which we can see in this particular situation. And going one step ahead, I just want to tell you all that adipocytes are coming as new stem cells. So when the medakshaya meda vriddhi is happening in obese individuals, other dhatus are undergoing kshaya. So in that case, the meda can be used as stem cells to give some regeneration to these other dhatus. Now these are all my crude thoughts, but these can be modulated further and we can come up with something which Ayurveda can give to modern biology. So this is just an example like how Ayurveda can contribute, Ayurvedic siddhantas can contribute to the modern research. And lastly, this is a very different kind of concept, that do we need research in Ayurvedic concepts. So what I mean to say here, that do we really need to do some research in siddhanta themselves, that do we need to ask few fundamental questions to ourselves, that whether these theories, whether these siddhantas are true in today's scenario also. If not, then do we need to do some additions, deletions, modifications to these. And if we accept this, that we have to do some changes, are we ready for that? Because we are typically in a thinking like we our science is complete and we don't have to do anything to our science. But this YouTube link I am not going to play here, but this is a talk by Dr. Kishore Patwardhan. Many of you might have seen this on YouTube, where he has talked like, do we really need to relook or revisit the Ayurvedic Siddhantas and consider that there is need to do some changes in these Siddhantas. Now I want to make a disclaimer that I'm not proposing this, though I have given this link. I'm not proposing or I'm not refuting this thought, but what I mean to say, that after 3000 years of Charak Samhita, are we ready to understand or to accept that there needs some changes in the hardcore Siddhantas also? If yes, then we should do some research on Ayurvedic concepts also. And I personally feel, though I said that I am not proponent or I am not refuting these thoughts, but I personally feel that there is need to revisit at least our Siddhantas and consider the need of upgradation, updation, revision, modification, whatever word we can use, of our own Siddhantas. So with this, I will stop here and I will take some questions if there are any.
Ma'am, there are no questions.
I think everybody is busy in Ganesh Puja today. So there are not really questions.
Maybe, ma'am. Maybe, possibly. Ma'am has very well explained this topic of Ayurveda Siddhant and contemporary research, a confluence. I would like to express my heartfelt thanks to ma'am for sharing her valuable insights and expertise with us. We truly appreciate your time and dedication in helping us learn. Thanks once again, ma'am. Uh, we hope that you will be again with us with new topic in succeeding talk. So with this, should we conclude, ma'am?
Yeah. Thank you once again.
Thank you once again, ma'am.